and welcome to this new episode of the Spotlight series. And I am very pleased to animate this webinar today. And before starting, let's take a few moments to check our technical details so that everybody can enjoy today's session. Please note that today's session is being recorded. The services of simultaneous interpretations are provided by both events. If you wish to listen to the interpreter's voice, please choose English in the interpretation menu in the bottom of the screen. If you don't see the interpretation menu, please click on the plus menu, and there you can select interpretation. Use the chat or raise your hand at any moment to share your questions. We also encourage you to answer comments and questions at your choice. If you need some technical support, please send a message to technical support in the chat. I would like to first recognize that we are here meeting on a territory that belongs to indigenous people. We are meeting on the traditional unceded territory that belongs to the Algonquin Nation. We appreciate the historical bond that unites us to this land where we are virtually meeting. I invite you to meet on the chat and to tell us where you find yourselves. Thank you from our to the Health Excellence Canada to invite us here. Please share where you find yourselves and which territory. Thank you. Next slide, please. So today, Spotlight is a privileged series that help us to improve and share the security in every country. The episode of today is presenting to go beyond prejudices. This special edition hopes to cover this topic of the Nationals Week of care for patients and listen to voices. We're invited to ask questions and to learn together to improve the security of care. We share the responsibility and we share the voices of this chapter, whether we are responsible for the healthcare. Your voice is important to everyone. Let's try today to discover how we can move from theory to practice and to act collectively to make sure that we can provide care in a more safer way at the country level. And today we are going to work together. So today we have three panel members, Tanya McDonald, who works at Purdue Health. And afterwards, we also listen to Cassandra Poitras, who is also works at Participation Partners. And finally, Isabelle Savard, who is Regional Director of Quebec, Vagrement Canada. So hello, all of you. Hello. And before we start the conversation, I asked Tanya to please introduce herself. Thank you. I'm very happy to participate into this conversation today regarding the security and care. And like Jerome said, I am a director of the community program for elders at Pure Health, which is a nonprofit organization in Ottawa. And today I'm at the non-ceded territory for the Algonquin people in Ottawa, and we are better known for our long stay services of 150 beds, but we also have many community programs of which I am responsible. And this includes lunch uh, for uh, for older people. And also, we have a program for people living with cognitive disorders, as well as a program for older people in our community who want to stay active in their while getting old. Thank you, Tanya. Let's go on with Cassandra. Hello, everyone. My name is Cassandra Poitras. I work governance and public administration, and I work in partners in the network of health in Quebec. I work in several levels, strategic committee, institutional, and I specialize in everything regarding disease, undiagnosed disease, and I also participate on several chapters. Thank you. Thank you, Cassandra. Isabel. Hello, everyone. Thank you for inviting me. I'm Isabel Sala. I am the regional director for Quebec and the French speaking community in Canada. I'm responsible for the supporting teams in institutions and homes in Quebec and French speaking Canada to carry out programs and support all these programs. It is a pleasure to be with you today. Since our first priority is security. Thank you, Isabel. So first of all, I was very lucky to look at some of the discussions that we will held with our panelists, and I was very excited to read the questions that we will deal with. And the first question that we wanted to ask you today is to talk about your role and what it means for you to contribute to safer care. So I would like to start with this, and Tanya, I would like to ask you that in a few minutes to tell us what it means for you to contribute to safer care. Thank you, Jerome. It's a very good question. And sometimes we really need to stop thinking about it, what it means to me in my daily life, but really to the safer care in the services that we give in programs is something that we think about every day and in every interactions that we provide to our clients and the participating in our care. So it starts by listening to the needs they have, whether physical, emotional, spiritual, and really make sure that our services and our programs are really oriented towards their needs. And if we build the trust with these people so that they can talk to us about what's going well and what's not going so well, always with a view to improving that, because it's really important to build these relationships, to really listen to them and to take their perspective into consideration every time that we are thinking about our services, our programs, our interactions. And also for the staff is to make sure that they have the tools to provide services that are really built on them, and to build trust with the team so that when something is not really working, that we can talk about it so that we can all learn. It's really creating a culture where we can normalize conversations with people whether participants, staff, the whole team, so that we can normalize conversations and so that we can move forward in view of being transparent and move forward. Thank you, Tanya. Let's go, Cassandra. Yes, so first of all, thank you, Tanya. I would like to go on with that. I am a patient partner, and I work on strategies and working groups and administrations with projects. So yes, we work with communities and parapublic instances. And my first objective is to offer my experience on the decision making, so that my experience is also profited from, and to talk with patients and with all stakeholders to bring forward a care approach focused on patient needs. And regarding the improving the safer care, we need to also think about the integration of patient partners in decision making and clinical practices, to bring them around the table and decision making, to significantly improve communication, and also work on vulgarization so that patients feel included, and going beyond patients, working among professionals to strengthen everything regarding the different sectors within the institutions, and everything that can be deployed outside, the collaboration between the different institutions. Thank you, Cassandra. Isabel? Yes, actually, throughout my career, I have worked at different roles. Before working at Agrément Canada, I worked at Health Network and worked on different positions as well as the Ministry of Health. And I've always worked at serving the public interest, and later in health, it was really the matter of quality and security of care. And for me, in the work I do, whether it's within my immediate team or the team of Raymond Canada, is to create conditions that favor learning within organizations, transparency, collaboration, and I do believe at collective intelligence. I think that when we are able of working together in interdisciplinary teams, we become smarter. And if we place ourselves in the patient's shoes, in partner shoes, in professionals and managers' shoes, this is very important, because then we can understand different perspectives. And what we create is quality and security. Thank you very much. I would like to know whether panelists would like to react on what they heard from the others. Well, myself, I think that we really complement each other in our visions, and I would like to share an anecdote. While I was working in the health networks, I had asked my teams, and I asked, why did you choose to work in health? And everybody said, well, this is because I want to help others. And this is, I think, something that bring us together, even if we come from different backgrounds. Absolutely. And what I've heard also that's very common in your three answers is there is really this interest of making sure that whatever the perspective, everybody must be at the heart of the decision making. What Isabel shared, is thinking of other, and this often comes from good intentions, even if you already have intentions in place. And I will give the floor to Cassandra. Yes, I would like also to share an anecdote. I think it's funny that we're together now, Isabel, because I also participate in the Conseil, in the Administrative Council, but I'm also patient partner there. And I think um, I am was talking about the process of Agramon Canada, and I give so I can participate with the different hats. I think it's really interesting that we are here today. This is an anecdote that I wanted to present, that often within institutions we can collaborate on different matters. Yes, and this brings me, I mean, you already started talking about the second question that we want to ask is, tell us about specific actions that can bring a safer healthcare. What actions can we take, yeah, that can contribute to safer care? Well, I broke the ice involuntary, but yes, it's an excellent example. It's an innovation that we had there, that we try to see how we can improve processes and implement practice in institutions among different professionals. And also, we try to work at this because these are terminologies that are quite heavy for patients, and we try to work on vulgarization so that patients can also present their experience to support teams. But this is not my experience, I just added that. But what I can bring is my own experience, that what I really loved is as a partner patient is maybe the greatest pride that I have is that I worked for Montreal, and I worked with several patients, and this brought me to the creation of the strategic plan on the policy on the rare disease. And here we speak of durability, and it's been 4 years that I work with them. So I moved from a patient partner, and so worked on the creation, and brought us to the process, the creation of the policy. And today I am working on the pilot project in Montreal, and we are preparing the policy. So this is one of my biggest pride. And I could really take up all our time to talk about this, but I would say that one of the things that I think is really beautiful is one of these projects that are in time and all the stages of the process, because it allows the patient to really work together, and it's really gratifying to say, well, I participated at this project not as someone who was at the end, but I really had a role. I made the change. And I think that this is what really would answer to your question, Jerome. Yes, and before to continue with the other panelists, you said, Cassandra, one of the things that for me uh, is that you were working there since the beginning, because we know that when we imply patience from the beginning, it's not always a big success. So, is there something else that you would like to share that gives winning factors for this experience? Well, I think it's important when the patient is really a stakeholder, that he will be recognized as much as a professional. And when we can see that because there are differences between the experience and the professional, and then this is not always recognized at the same level. So, then yes, the physician cannot replace the patient, and the patient cannot replace the physician. Could we maybe look at this in a complementary way? We'll give you a funny example. When we have a problem with the car and we cannot fix, who do we see? Well, we go to the mechanic. But if we don't tell him the problem of the car, doesn't mean that the mechanic will necessarily fix the car. And this is when we realize that they're both complementary. And I think that this is the feeling that's most important, to accept that the patient is not just a user, but it's really a participant that really will help to the achievement of the goal. And it's important for the patient to feel safe and appreciated. So the patient contributes as a collaborator, and that's fun for the patient. So I think that here we can really analyze deeply this relationship. Thank you. Thank you. Yes, the acknowledgement of the contribution of the patient in every aspect of the process. Thank you, Cassandra. And now let's move on to Isabel. What specific action would contribute to safer care? Well, actually, for me, in the last projects that I worked on, what actually I find fascinating is developments of using, and they are extraordinary things that have been developed. And I think specifically on a project where the home extensive treatments are being developed. They are having very interesting results, like 35% less admission in psychiatry have been achieved. And before we go further, maybe we can talk about uh, more details. What globally, what does it mean? Well, globally, well, this project, um, let's say that instead of having the patient hospitalized, this person stays at home, and there is a follow-up. Professionals are coming, physicians. But the idea is really to become an alternative to being internalized, like as hospitalized. And this is really interesting. And among the consequences, we avoided to have prolonged hospitalization. This might have very important consequences, very negative consequences. These orientations for vulnerable patients, and this care are more human, more personalized, and they help the caring team to have access to the environment of the patient, to create bonds with the family, with the family members, and to have feedback. So really, very positive to do this. And at the same time, it brings us back to serious protocols. It's very well, it's very safe. And among other things, this experience is very positive for patients. To be hospitalized or internalized in a psychiatric hospital is better to be avoided, because they are, this can be disturbing for patients, where security measures are quite high, where when a patient is suffering from a condition that does not necessitate this high levels of security. So by this adaptation, we can also uh, understand the environment and the social network of the patient to better facilitate the healing of the patient, or the transition of the experience of care, so that it becomes more harmonious. And this also takes into account the environment of life. Yes, yes, exactly. Thank you, Isabel. Tanya? I'm so happy that Isabel spoke about all the possibilities in community, because, yes, and I agree completely. I am less in the, I'm more oriented toward the complex or aging population, which are most of them. We already know that the very high percentage wishes to stay at home. And we know that there's a lot of pressure on the health system. Like, I'm speaking for Ontario, but I think it's the same everywhere throughout the country. We have lots of people who are who want to who are looking for alternatives, and they are looking at we're not always ready for all the elements needed to make sure that the transfer will happen in a secure way. So it's important to work with well-established protocols and to work in partnerships with the hospital and community partners so that they will help the people, the patients, to make sure that the care that we are offer are relevant and offered in a secure way. So we have all these matters in at the level of community communication, and uh, and of course, um, specifically, eh, there are. It's really important to work all the communities, all the partners to make sure that we work all together. So I really appreciate what Cassandra brings us with all the perspective for everyone to support everyone in their life quality and security. I think this is really in a specific way that we can contribute to the security of patients every day. Thank you. And you just mentioned something that's very important and an element that everybody contributed to the notion of the needs of patients. In this regard, I would like to give the mic to Cassandra to maybe explain some of the challenges. Cassandra, would you like to name um, maybe a few? If I understood the question, they would say that, well, I would say that there are a few, and one of the things is how can I be a partner patient? I think, first of all, there's some decisions I with many patients can make a difference. I would say there is a lack of communication and the opportunities of getting involved. And I think that often the institutions are not enough involved with the patients. And so we want to work at a practice, and instead of having patients coming and saying, I want to get involved, it should be the institution saying, reaching out to patients, saying, "Oh, we need you. We would like to have you around the table," and to see how the institutions can challenge the patients and involve them. And some patients, well, we have the question of whether we should involve them as volunteers or actually create maybe some payment for them. We also see that these are older people and they might have a problem. Maybe if they get a salary, they might have a problem. Or some people younger who will sacrifice the work time to participate in projects. So what are we going to actually remunerate or not? So this should be the institution. The institution will have um, this remuneration or not. So this will create maybe a situation. So will create let's say, a situation regarding payment or not, and also the question about language. This will also create a situation regarding the language situation. Maybe the person can participate on site, online, and maybe there can be Zoom meetings like today. Maybe there can be a transcription for the participation. And I think also there is the stigma, so like I said earlier, the difference between the experience. I don't know if this answers your question.
No, one of the things that has been raised in the question in a written manner is the level of the complexity of care's journey. I think that people are connected through this would like to hear about that. So, what are the concrete actions you can carry out to make care safer given this complexity? Yes, it's certainly. As I said earlier, I'm specialized in everything which is the care of people who uh, I have been a patient without a diagnosis for 10 years who has difficulties because of genetics, and people have seen my case. So we have considered going outside to carry out tests because here we are at the limit of our capabilities. So it is certain that when we have a context, we need to have a collaboration with different actors. For example, in my file, I have several specialists. I've got dermatologists, neurologists, other specialists who mean that we work with collaboration with the patient. And when patient has complex illnesses, and they become a key actor. For example, what has struck me is this point where the doctor says, I do not have any answers to give you, and you don't have any answers either. They say, but we're going to work together so that we bring out our strengths to try and find a diagnosis. Because as a professional, I want to be able to offer a diagnosis. It's not nice not to. I feel that it is failure. So I want to listen to the patient to avoid constant stress. So from that, I became truly somebody who could bring information, the symptoms, the treatments which worked, what worked better, what worked less, and all of these answers, uh, whether it was related to genetics, blood radiologists. It's only the patient who can bring this information. And it became a collaboration because the professionals speak to each other to be able to provide treatments that work. But also sometimes I see what is in my file. And this is something I work with other people's other realities, I realized that it is not something certain in the health system. We often work in silos. We talk about the inputting things into practice, but I have the opportunity to be exposed to a collaboration with professionals, and they said that they could see the difference in the care journey. Because sometimes doctors say, I'm going to use this treatment, and the doctor says, no, no, that is going to create more symptoms, in fact. So I don't know if that answers your questions, but I think we can say that we are looking for a lot of things in terms of communication, intersector work. Um, which has a lot of challenges across the network, but I have had the opportunity to have this on my journey. In fact, what I can also hear, thank you for sharing this, it is truly the notion of a team, that the patient is part of this team. And so this comes back to what you mentioned a bit earlier in terms of recognition of the patient's journey to serve also the development of the expertise in care and treatment, rather than just strictly scientific knowledge in the life of people. Tanya. I think it's very interesting what Cassandra is saying, and I also see that in the experience of old people who are trying to navigate a health system which needs certain services and they get lost and they are lost in the system sometimes. And they are the people who have the most information, the most knowledge about their journey on the information about services, what they have already had, for example, in terms of home care services with other partners. So it is really important to not lose these people in the system. And truly, I think that our role in terms of safety is to really avoid bureaucracy and ensure that the services meet the people. For example, we've had experiences in the healthcare systems where people are lost, but truly the role is to navigate, ensure that we perhaps eliminate some barriers to ensure that people are truly connected to the services because it is them who know their own journeys. And we've also tried to work to see what path, what route they are following, what they are living. So ensure that the information is put in the right place during their journey so that they have the information earlier. But it's very complex. The system is complex. There are many partners. There are many organizations which provide services and non-profit organizations, charitable organizations. It is important to work together, as Cassandra said, because when we work together, we get better results. I think we've said that earlier. The collective impact is truly important, and I can also hear under what you're saying, Tanya. There is a level of complexity, but there are also things which are complicated when we are talking about administrative tasks. For example, it is what we do to get closer between the system of the needs of the population. How can we feed the system, align it with needs, and not adjust the needs to the operation of the system? That's what I hear through what you are saying. Cassandra wanted to respond to Tanya, but yes, you've partially answered what I was going to say, Jerome. But what I would say is that the things that I can see too, particularly in the case of old people, is that responsibilities are applied to the patient. And the more this is complex, the more it is going to come back to the patient. The problem is that some patients are unable to answer these challenges. I'm sorry, I'm losing my voice. But the problem is that in the cases we see where people, migrants, people who have linguistic problems, old people, deficient people, these particular people, what is complex is the levels of the system. And the challenge which makes this complex that we cannot take this challenge and offload it onto the professional because the professional needs to be able to do what they are meant to do as a professional. So they're with a heavy, burdensome bureaucracy for the patient and also for the professional side. So to talk about Tanya's point, we're not talking about the impact, but there's also the question of what we can do higher up to help what is going on at lower levels. So, what are your considerations here? What are your concrete considerations that we could bring in order to reduce these barriers to patient safety? Who's going to go first? Tanya. Well, I, like everybody, I've had a journey. I've worked nationally in the last 7 years of my career, so I've come back to the network after several years of absence, and so what I see is the opportunity. It's not a mystery. It is the system. The full system needs to adapt to the new reality. Well, the new reality. It's always been like that, but people are complex. Their health is complex, and it really you need to work together. In my daily work, I see housing, health, everything on a social side, all is integrated. It is not in three different compartments or silos. The system, first of all, needs to work in a more integrated way, rather than a competition between ministries for grants, for programs to support people who are living what they see on a daily basis. They're not interested in silos in compartments. and the grants for a program. This needs to be more integrated. It needs to be more holistic to really meet the needs of people. And I think that that must be shared tranquilly from ministries through the health systems, the ways we are organized, and also in the field in terms of organizations which truly want to work on the well-being of people, to work with them. So we know that people say there are policies which exist to manage things, but in practice, it's not always like that. So I think also we need to look at the reality of the challenges lived across the within the network, and I think that provides data which will speak to different governments, to different healthcare systems, community systems, people, patients, and we need to have a portrait to talk about the impacts, the effects, the experiences, maybe to use that to have a more effective integrated system. So basically, what I can see there is two things are important: integration, having a systemic vision, and also the importance of having data to take the right decisions in order to have a better integration of the health services. If I could, I can see I've a lot of hope, in fact, on the different initiatives currently to have more room for the patient and their families. I look at the development, as I said, Hurley. I previously was in the healthcare network in Quebec, and I saw an incredible development, everything to do with partnerships of patients and families, which we also see elsewhere. It's very important with significant initiatives which are carried out, and there is truly a desire in objectives with in terms of leadership too to develop these partnerships which are interesting. And what we can also see is patients who are included in visits who are evaluated in terms of these approvals, which are not in Quebec, but that happens elsewhere. Where is the opportunity to have this in Quebec? So these initiatives exist and give me a lot of hope because we are truly living. We are trying to approach the offer of service to the valor of the values in the eyes of the patient and truly move closer to these needs. I think this is interesting. All of these initiatives are interesting with a very fast development taking place. Thank you very much. And in fact, Isabel, you're talking about the notion of values, which brings me to the next question. You know, clearly, or particularly here in Canada, we see more and more people who take their retirement, who worked in health systems through the different provinces and territories. And we also, at the same time, have new recruits who join these systems who are complex, which raise certain challenges. As you said from the beginning, if you had measures to advise to these people to improve patient safety, what would that be? So I'm going to start this time with Isabel. In fact, the first thing I would tell them is bravo, you have chosen an extraordinary profession because the healthcare domain is fascinating. I would tell them, first of all, to be curious, to approach their profession, their skill with curiosity. Ask questions too, not to be frightened. To talk, to express themselves when there are things which appear slightly risky, because safety starts with vigilance, which is shared by everybody, by communication, which is open too, between people. And there are lots of problems, in fact, and health risks through this communication, this opening, and the ability to ask questions. What I have seen through all across all of these years is there are many things which have protocols which appear truly complicated, not complex, but truly complicated. And sometimes people see it's complicated, and sometimes they I think that it is important to ask questions and to take the time to understand things. Most of the time, these protocols or these ways of doing things were put in place to protect patients, teams, and to manage their reasons for being. And this needs to be questioned, and often it is important to take the time to fully understand things. And when we understand them, we can explain them too to other people. It completely changes the way we look at this and to say that it's in the nature of things to follow these. So what it is creating meaning. Yes, absolutely. So the importance for me is that when somebody starts in a profession, in a role, I would say it is to be curious, to get engaged. Then following that, we win and we progress as an individual across all of this learning. Okay, thank you very much. So this also comes to back what we heard earlier, for the notion of collective. Yes, absolutely. So Cassandra. Yes, it's an excellent question, and I've got two answers, two sub-answers to this question. First of all, I agree what Isabel and Tanya said earlier. The fact of thanking people because it is not an easy domain, whether it's a nurse, doctor, or whatever. It is not an easy job. So I would also say, in terms of professionals and patients, it is also to say that you cannot know everything. You need to be curious. You need to have need of others. It's right. You're in a profession. It's normal. You're working in a profession where sometimes you need to go and knock on somebody else's door to look for information because you do not have the information at the tip of your fingers. That's right. The second thing I'm going to put back on my patient hat. What I would say is truly safety when you are a patient is a question which I can see personally when I've seen several things. I've seen things which were good and which were less good, which were bad. But what I would say is that I would choose, if I had to choose one measure, it is safety for patients, their close, and professionals. It's a collaboration. I'm coming back to true collaboration between the various actors and every person. It is fundamental to having a collective approach to break silos, both within institutions, externally, but also to have a dialogue, a mutual recognition, sectoral work to be more safe, to be more human, to be more effective. And I think it is there again, working in collaboration because visions are different. You could ask a professional for you, what is safer care? If the professional feels that there is support with their workload, their mental health, they will be more disposed to provide an effective service for the patient. But the question for the patient for you is to see what is a safer healthcare process. The answer will be completely different. And there, once again, this reflection. It should be done earlier and not during by managing a crisis. That means that the actors around the table can see the process and it can develop more effectively. Which comes back to what Isabel and Tanya said. We can put in place processes, internal processes, external processes, but there are many measures, and I agree with Isabel there. It is truly to have an exceptional patient journey. When you have a process within the institutions, you can see, as a patient, I'm very happy to see that we can talk about initiatives, but in terms of the law put in place for the reform of healthcare systems. Among the objectives is the partner patient and indeed the journey, the patient's healthcare journey as part of a reflection. And as a patient, I'm happy. I don't know how it'll work in the practice, but I'm struck by this reflection to a certain extent. So thank you. What I can hear here in the different elements that you have raised is the importance of creating environments which are favorable to discussions on patient safety, because that is not just actions, but also the exchanges of different point of views. That is what I can hear in what you are saying to us. And not just to be reactive in crisis situations. So thank you very much. Tanya. Yes, I think it's curiosity too. It's asking questions, listening, understanding, observing, not reacting, taking the time to understand all perspectives and challenges, or to truly use this optic or to improve the quality, but also to implement what we learn. We also must not be frightened of trying something if it doesn't work. We can come back as a team to look what we have put in place to see what works less well, and to adapt then, because that is how we learn, I think, through trying things and making mistakes. So truly, this is to improve the experience of the services that we offer to people, but it is to have these conversations with humility, because I have understood throughout my career that I do not everything, I do not have all of the answers, and I learn every day. And so for me, I learn from everybody. I love observing, listening, seeing, understanding the perspectives of other to truly bring us elsewhere and to enable us to put in place improvements so that everybody feels that they are stakeholders and part of a team. So that is what I think too. But also, thank you very much for working in the healthcare segment. It is not easy. Sometimes we can be discouraged, but there are so many good practices. We don't speak about this enough. So we really need to flag them, highlight them, and that's important. So basically, there are two things. What I can see also in what you have said since the start of our session today is this notion of learning as an individual, but also what we do is to try, Tanya, what you said basically is to try and improve. That doesn't mean that everything will be perfect, but mistakes are part of learning as a group, as an organization, as a collectivity to try and do better. That is part of the notion of humility to create better conditions, as Cassandra said, with a favorable environment for discussions. Thank you very much. Before moving to the next question, in fact, I'm going to reiterate to people who are with us today that if you have questions, you can use the chat, the FAQ for our panelists. So please don't hesitate to do so, either in French or in English. We will take your questions with pleasure. And so now we are going to come on to the next topic, which is, in fact, you have already mentioned a bit this aspect. So I just wanted to ask you to ask if you have another element to bring in terms of patient safety. You said you think that begins through collaboration, so through teams. So you have given some examples of how you collaborate with other professionals, other people involved in the patient journey. What could you add to this dimension of collaboration? Well, maybe just in addition, in our programs, the question of interdisciplinarity is clear that data guarantees the safety of care, but it is part basically of the dimension that we are assessing. We encourage systematically that there be a collaboration. It is true within our teams too. We have people with very different journeys sometimes who take part in this evaluation. And it is true even within the organization, or if I take the example of my immediate team, we have people with completely different journeys, different training as well. And this enables us to develop programs, ways of doing things which are a lot more complete. And in this sense, when we are talking about interdisciplinary collaboration, it is important to include the patient in all of that and their family. because patient, when I talk about patient, I'm often talking about their families too, because that is part of the people who are important in this relationship. And so it is important to be able to include these people because that gives us a an ability to consider more what happens truly, and sometimes also that gives us other points of view, which means that solutions are more appropriate and more sustainable over time as well because they are more concrete. So I'm thinking about collective work. Once again, this applies, I think. Excellent. Thank you very much. So basically, Tanya, Cassandra, do you want to respond? Do you have anything else to add to what Isabel has just said? Maybe I would like to add something. What I would have said earlier, but I have got something to add with terms of what is happening is unfortunately collaboration, intersectoral collaboration in Quebec is we are in a pan-Canadian context, so is everybody involved? Not necessarily. Sometimes care is fragmented and the teams work in silos. This is a topic that comes back. That has an impact of the patient on the patient journey. We spoke about it earlier. We also have the bureaucratic process, which so I know that sometimes this has an impact on professionals and patients who can also be in a situation where they are isolated or overloaded and they don't know what to do with the patient. Where do I do it? What do I do? That's outside my skill set and in complex cases. Or so where should I send it? Where is their room? How am I going? What am I going to give the patient as information? You know, this is not always agreeable for the professional there, and I think it is important to strengthen discipline to help the resources and to recognize the complexity that we do not know everything, and the care journey is can be more consistent, but also to make everything more fluid so that the patient has fewer breaks and for the professional to also have fewer breaks. So having multiple points of view with the idea of creating journeys, care journeys, which also have the prospects of individualizing the services, the care, healthcare services to meet the patient's needs. So to a double challenge, in fact. Thank you very much, Cassandra. We have somebody who has asked a question in the chat. I think the question is for Isabel. Is there any development in Alberta for home hospitalization services? If so, what about care for Francophone seniors who have language barriers? These are two excellent questions. I have to see that I know less about the healthcare system in Alberta, but basically, I truly hope it would be developed. If it is not the case in Alberta, maybe I would invite the person who has asked the question to become to connect to me on LinkedIn, and then I can put them in touch with people who can answer their question. I'm sorry, but I'm curious to have this answer. In fact, excellent. Thank you very much. We have spoken through the different questions and with the different discussions about how we can create environments which are safer to ensure that we contribute to health, to improving care. So the prospects from the point of view of health leaders, patients, or anybody else according to you, what are the other key elements that we have? You've spoken about open communication, listening, curiosity. According to you, are there other elements which we have not discussed today, which would be key for you to create this environment to improve patient safety? Tanya. So to maintain good relationships with our partners, I'm going to come back a bit to what Cassandra has said. It is easy on a daily basis to just move forwards to try and bring everything together, to try and put everything for the program for services for somebody within the system. But I think that we truly sometimes need to look up, look at what's happening with the partners to make sure that we can maintain good relations because that will help us over time to ensure that we offer a quality of service for our patients, the participants in our program. So I think that basically it means having good relationships, which go both ways, not just always take and take, but be stakeholders with our partners. Thank you very much. The notice of respect in partnerships. Cassandra, off you go. Yes, thank you very much. It's a question which strikes me personally. I have an experience in policy and as a patient, so I'm going to try to centralize this answer to, in terms of what Tanya said, I am convinced that every actor has an essential role to play. The relevance of all stakeholders, patients or professionals need to be involved. Everybody needs to be able to build a true approach, a co-construction. I'm talking about this co-construction here to answer the needs that we have mentioned. And I think also we need to have a true place for every voice around the table at every step of the process to have a dynamic which is balanced and which goes in both directions. To have a top-down, down-up approach as much as possible, it is important to be positive and inclusive. And I think too that I don't want to. So sometimes we're talking about what is political and what is happening in the field, and sometimes we can work together to break through this particular barrier, which this dynamic of power to improve the process. And I think people have a role to play, but at the end of the day, the decision-making bodies also have a role to play in their work too. Thank you. Thank you for the systematic input.
Thank you for everything. And while we can hear how to regather all these actors, Isabel, actually, we see that everybody is important here. And I go back to most formal leadership. And these are the people who actually give time in an organization and give direction to their teams. And in this sense, their role are very important. It is them who give the possibility to discuss of what's going well and less well. They influence directly culture at the level of security. And I note that if, for example, I try to compare organizations regarding their performance, there is a difference regarding strong leadership with strong qualities in matters of security. And obviously, there is an important influence, and which is manifested by an propensity to have these influence, even if they are fed from the field, from professionals. And in this sense, I think that the role is really very important and to have it fully. Thank you. We saw many things, and we've saw that this continuous improvement to improve the. We see that there is a direction, there's vision. Yes, and if I can continue, that this would be good in the procedure towards an institution if we really start with the governmental institutions and we start with, for example, in Canada, we realize that the needs in the Canada are not the same. Um, the needs are not the same. So often to come back the institutions, we don't have the same reality, but with these studies and the proofs, we are not even able to expose, oh, say, oh, this reality was not part of the questions. And it's true that it's a reality that we find that often the care or even the distance between the resources and the patient is much longer than in Montreal. So we see this is an important approach, and I wanted to just add this point. And just to clarify it for people outside of Quebec, CIS is this integrated center of health, and the socio is the social services of integrated health center. And we are almost at the end of our session, and so I would like to thank you, Tanya, Cassandra, Isabel, for this discussion that we've had, which has been so enriching. And actually, to close the panel before giving other information to the people who are connected with us, I would like to ask you what actually inspires you, because if you're working at the network today, what really inspires you matters of patient security? What makes you keep hope in the what can be improved to make sure that we are always in this continuous improvement? Well, actually, it's been a while since I started to work in health, and I'm still very motivated to do what I do because through time I have seen improvement. That of course there are things to work on, but there are improvement. There are things that are going very well daily, and I think that we need to bet on that, and often. Um, every single improvement is showing us the greatness of the project, and I think we should stay focused on that, and every improvement, as small as it is, can have an important impact, even save lives. And what I really like, and again an anecdote, sometimes I am a patient, and when we use a double identifier to know whether I am the right person for the treatment, I must confess that I'm glad, because I tell myself that somewhere we learn collectively, and this is a security thing that is applied daily everywhere. And I think that everything motivates me because. I think it's really something that motivates me every day. And essentially, yes, we can do things to improve, but it's really something that can help us to improve coherence in the health system. Yes, I don't think there are small improvements. They are just improvements, and that's the message, and everybody can really contribute. Thank you very much, Tanya. What actually inspires me is creativity and perseverance of the people working in the network. I worked with Atamon Canada for 5 years, and I was in charge of the best practices of the program. And that inspired me so much to see the creativity of the people who were working every day on the network with this view of improvement of quality. And it was not just new technology, new things, it was just changes at the daily level that would take into account the perspective of patients, of people who are working in the field. And for me, it was just inspiring that people were really persevering on the system, and that they take into account the experience of the patients and their own experience of the network. We could see it every day. And this ability of having continuous adaptation, we could see constant changes in the program, but people are so creative and persevering that this will always inspire me with this view of making sure that the services we offer are really good quality, um, give security to the staff and person, the patients. Thank you, Tanya. So all this dimension of being creative and of finding a new system of control to continue moving forward with the spirit of improvement. Cassandra. Yes, I agree with Tanya and Isabel with their approach. And what I say is that every change counts. And when I involve myself with the patient, I always say, well, we're talking about a human life. And if we manage to improve the health system and the cares, it's always about the patient. Even at the professional level, I think that we have dealt different level, and I think security, I think we need to see from a global perspective, um, the patient manage to work together and to improve the security of care. And every time I get involved, I always say, I love my own difference. I'm not at the level of the ministry, and I just see. But maybe today's conference will have an impact. Maybe will have changed a little bit in the everyone's little environment. So yeah, thank you very much, Cassandra. So in summary, if I take keywords that you used today, obviously we have the complementary of the roles, the unique contributions that each one of us does in the care, and the collaboration, the importance of build the trust, relationships, partnerships, and this is also based on leadership and the perspective of continuously learn and always listen. And this is something that you really spoke about, because it's by listening to each other that we will co-build this notion that Cassandra talked about, to co-build safety together through evolution, and how we will give uh, safety through more robust community services to make sure that we can serve the needs for people who have these needs, let it, in the environment where they are evolving. So thank you again for today's discussion. And to continue, we know that in excellence, the Health Excellence Canada, we are focused on action. So let me invite you all here to take a moment and visit our website. You will see also on the chat there will be a reference, a link with the challenge in appropriate care in Healthcare Canada. And you can launch initiatives with the goal of having the right care at the right time in the right place, in order to avoid emergency care. So you can participate in the challenge and to celebrate the daily care. And you can have access to monetary rewards, and also the funds from HEC to help you to have these awards. You can actually present your postulate until tomorrow, which is the deadline. If you have questions, you can reach people, those who are in charge of this. Thank you so much for participating. We hope that today's event was helpful, and that you could that it was helpful for you, that it brought you insights and brought you ideas on how to um, bring new innovations to strengthen the care. And you will receive an email with this recording and some resources that you can share with your colleagues. You can share with your colleagues what you heard today. And at the end, you will see a survey on the screen. Your comments are very precious to improve how we work with all of you throughout the country. So please take the time to answer to the survey. You can also subscribe to the list this, to receive our newsletter and participate in events such as today. And I would like to thank again Tanya, Cassandra, and Isabel to be with us today. And we so for me it was a pleasure to host this spotlight series. Thank you, everyone. Thank you. Bye bye.